Hey y'all, I just listened to a podcast earlier, I think last week, and I just thought there were some things in it that were so helpful and interesting. I wanted to share that with y'all. It's a podcast by Nicole Goldfarb. It's called Airway Answers, and it's immensely helpful if y'all want to look that up. The doctor she interviewed was Dr. Michael, and I forgot now because I just said her name. Let me check it. But he is an oral maxillofacial surgeon. It's Michael Gunson. I'll put a link to the post of the podcast if you want to listen to it. But he was talking about the MMA surgeries, the maxillomandibular advancement surgeries that was recommended for my daughter. And I was just curious to learn more about that. And that's where this came from. But he had mentioned about facial pain. He was talking about that and said, or even just head pain. He said that the face was made for 3 reasons. So the purpose of the face is there are 3 things. 1 is breathing. That's the most important. 2 is eating. And the 3rd one is communication. And it could be whether talking or just even facial expressions that you can do, you're communicating with that. And he said when the muscles around that, whether you're breathing or eating or communicating, are not functioning the way they're supposed to function, if something's off a little bit, then it causes other muscles to compensate, and those muscles are having to work harder, which then can lead to pain. The body's just trying to tell you this is too much and this is painful. So for example, if breathing, let's say that's the most important thing in our face, when we're breathing, if we have like a deviated septum or something is off in the jaw, like for my daughter, it's set too far back and the airway is restricted, like for her case, and I mentioned this in an earlier video, she's compensating, or a lot of people do, by slouching forward. Well, that then affects the shoulders and the neck muscles because they're not functioning the way they're supposed to function and can cause extra strain on that. If somebody has their teeth aren't hitting like within each other the way they're supposed to, and they're all out of whack, that can throw the muscles all in here off. And some are working harder than others to help you chew the way you're supposed to chew. And especially at night when you're sleeping, a lot of times we clench. A lot of times it has to do with an airway obstruction or restriction being too small. Maybe our jaw will come forward or we're clenching. Clenching is a sign of airway. And that tightening like that, when you're doing that at night, it's overworking these muscles more than they should be, which is overworking. And it can cause pain on that. If you're speaking, sometimes people maybe have a tongue tie and they're moving their tongue in a certain way to communicate clearly, and you don't even realize you're doing this, but your tongue is moving in a certain way to do your S's right or your R's right, and it's compensating that tongue to work in a certain way that it also actually can compensate the neck. I have that issue too when I talk. So it's overworking those areas and can cause some pain. Making sure I've got everything I want to talk about. Yeah, I just thought that was really interesting. That's the overworking of the muscles. So the job of the myofunctional therapy, which I'm hoping to start training next month, is to observe a patient and see, like they can watch them chew, they can watch them talk and see if something is just out of balance, and that they can see that's where the muscle is overworking and pinpoint that and say, okay, this is what we need to get fixed, whether it's an airway issue or maybe braces to get the occlusion, which means how your teeth fit together, to get that fixed properly, or potentially getting a tongue tie clipped so that your tongue can have, and followed with myofunctional therapy, so that your tongue can have the flexibility it needs to move and be used the way it's intended to be used. But just wanted to give you all that bit of information. Again, I will post the link to the podcast. There's also a YouTube of the same one. You could search for that. But pain is a result of overuse of the muscles, and overuse is when something is out of whack, whether it be how your teeth fit together, whether it be an airway obstruction and things just compensating in certain ways, or whether it be your tongue not being able to function the way it's supposed to because it's too hindered by the tongue tie. See you later.